not be here. We'll make sure that they are able to get this recording. Well, good afternoon, everyone. It is good to have you here today. And I know that there are lots of questions we have, and we have a specialist to help us answer some of those questions, Andres Villas. And Andres will be talking to us in just a minute, and then we will get started. Before we do that, I was checking in with Dania and asked Dania if she would be willing to have a prayer for us as we begin today, and then we will get started. So thank you, Dania. If you'll unmute yourself. There you go. Yeah, there you go.
Silent prayer.
That's all right. Silent prayer. All right.
All right, everybody. Let's say a prayer. Merciful God, who is over all peace. Father, I ask that your peace be upon us as we come together to learn how to better serve the people that you put in our presence. I pray that you would give us the wisdom to do the things that we need to do. I pray that you would give us peace that passes all understanding, with the knowledge that you will direct our steps. You will go to where we need to go, and we will help those we need to help. I pray peace over this office and unify us as servants of you. In your name we pray. Amen.
Amen. Thank you very much, Dania. I appreciate that. As we begin today, before I turn it over to Andres, and I think Andres will take us through some steps just in case you haven't seen the videos, and it doesn't hurt. I'm learning to do it more than one time, or to see things more than once or hear them. But as I mentioned to others, if you have questions along the way, if you'll put those in the chat box, and then we will be able to get to those questions. And so I'm going to ask Andres, if you don't mind, we'll turn it over to you. And we appreciate so much you being able to be with us today, Andres. And also one of the suggestions, Andres, and I don't know if it works for you without the mask, but would it be possible for you to talk to us without a mask? Or if it's not, we certainly understand that.
Yeah, I think I'll put it in the chat, but I'm going to need to keep my mask on. Except for when changing to the N95. This is a shared space.
Yes.
So some of the goals are to reduce kind of environmental burdens, and that's also one of the things that I'll talk about here in my presentation. But yeah, sorry about that. Yeah,
that's all right. We'll have to get you a remote mic or something in the future. So thank you, Andres, for being with us. And Andres, am I pronouncing your name correctly?
You are.
Okay. Well,
so when I introduce myself, I say Andres, but in Spanish, the A is a softer A. So
Andres.
I grew up in Western Kentucky and North Alabama, so they say Andres.
Okay, good. Yeah, from Andres to Andrew, huh?
Yeah.
Well, thank you, Andres. If you will go ahead and get started, and then we'll have some time for some questions. And thank you again.
Yeah, sure. Before I get started, I really just want to say thank you guys for the important work you do. Those that know me know my background is nursing, the majority over 20 years. Most of it has been in the ER. So Sarah, I recognize you, and David also, even though I don't think you were down there when I was there, I do see you there when I'm passing through. So thank you guys for the important work you do for our patients, our staff, and their families every day. I think it's understating what you do for all of us. So thank you. I also want to kind of acknowledge what some of you may be feeling. because it's no different than I'm sure what I felt and many of us felt when this pandemic first started. You're probably feeling a little bit of anxiety of now knowing that you're going to have to come in potential contact with something that's pretty scary, or can be. But I will assure you that I want you to trust that what UAB has done is create a process for you guys to be able to safely do what you are being asked to do. We've been doing this since March, and to be honest with you, the transmission from patients to staff, I want to say it's zero. I haven't heard of any reported cases of people getting sick from patients. And for a long time, we didn't have any staff getting sick because of the things that we're doing in the hospital. We're seeing more staff getting sick, but it's not because they're getting it from patients. They're getting it from the community. So the practices we have in the hospital are keeping us safe, but then when we get out of the hospital setting and back in our communities, sometimes we get a little more lax in our practices, and there have been some more exposures. There have also been some employee-to-employee exposures that we've seen more recently. So trust that the processes that we're asking you to follow will keep you safe. So I'm not going to tell you don't be nervous, because I know you will be. I was, and I still am. But hopefully you'll feel a little more confident in your ability to keep yourself, your families, and those around you safe. All right, so I'm going to stop with that. And now I'm going to give my simple introduction and tell you why I'm the person here speaking to you, what qualifies me to do this. So again, I've been a nurse over 20 years. I've also 13 years in the military. I've done a lot with biosafety, disaster, and emergency relief. I'm currently, the role that I'm functioning as in today is I'm the training coordinator for UAB's Serious Infectious Disease Team. So since 2014, I've been a member of UAB's Serious Infectious Disease Team. So we responded to the Ebola threat, and we've continued. So now I help train those to respond to these types of events. So that's kind of what makes me qualified to speak to you here today. What you can expect in the next, I guess, about 20 minutes is I'm going to give you a little bit of background information about the different types of PPE that you'll be wearing, or personal protective equipment, what each specific piece kind of protects you from, what type of patients you would be using this for, and then I'm going to provide you kind of a narrated demonstration of the process of putting on and taking off the PPE. Then we'll pause and we'll have a kind of a Q&A session, a brief Q&A session, and then I'm going to do a second demonstration, unnarrated, just going straight through the process without me narrating it, to give you another opportunity, one, to just see it again. And I know it sounds kind of corny, but if you choose to kind of follow along at home and go through the motions, that's also something, an opportunity for you to just to kind of get some muscle memory. And I do know some of you probably have already been putting on and taking off PPE, but this is an opportunity to do it with some feedback and ask questions. You don't typically get to do that in the clinical environment. You put it on and you hope you did it well, but nobody ever actually tells you if you did or not. All right, so I talked a little bit about the resources that UAB and processes that UAB has created. And just know that all of this has been based off of current CDC requirements. So we didn't just make this up. This is based off sound science and evidence. So CDC and our infection control and prevention practitioners help kind of vet the processes that we're going to be showing you today. We also are part of a serious infectious disease network. So we also model practices from those other hospitals in the network around the nation. All right, so that's number one. Where can you find some of the resources? So Malcolm already sent you a few of the things, but if you go to the UAB1 website, under the Corona page, there's a whole section on personal protective equipment. There's checklists, videos, and other things, other kind of infograms from infection prevention. So that's a great site. Our site also, there's a section with all the videos of the different PPE configurations that we've been asked to replicate. I did ask Malcolm to send you the specific ones that I think you'll be encountering to save you from having to sift through all those other videos and PPE that you may not ever wear. So what I'm going to demonstrate today is what I believe, and this was again, I checked with infection prevention to verify this, the PPE that we believe that you would be using when encountering these patients. All right, so the PPE that we're going to be showing is what we call respiratory enhanced. So it includes a gown, and it may be a yellow cloth gown, maybe a yellow disposable gown or a blue disposable gown, but it will be a gown. For COVID positive, or what we call PUI or suspected patients, you're going to wear an N95 mask. You're going to wear gloves, and then you'll wear a face shield. And the face shield is kind of the enhanced piece. So the gown protects you from contact against surfaces. And if somebody were to cough without a mask in your presence, the gown is like an additional barrier between you and your clothes. The gloves obviously protect your hands from direct contact. The mask protects your nose and mouth. And then the face shield is an additional covering for the eyes. Because what we know is, we call this the zone of contact or exposure, is your eyes, your nose, and your mouth. So those are the ways that this virus typically will you come in contact with it, and then it enters your body within these three places. So those, the PPE, the mask, and the shield protect you from touching those, from direct contact from somebody coughing or sneezing, but also from you inadvertently touching those. And we do know that people on average, not just healthcare workers, touch their face almost 20 to 30 times in an hour. So I just realized a while ago when I was about to talk to you, I scratched my eyebrow because I had an itch, and I was thinking, oh, there's one. So we most of the times we're not even aware that we did it. All right, so that's the PPE and what it protects you from. The type of patients you would use this level of PPE on are the COVID positive patients, or the ones that we call, you may have heard them referred to as PUI, person under investigation. So this is a person who has the symptoms, so if it looks like a duck, quacks like a duck, walks like a duck, it's a duck. So these are the patients who they have a good story, they may be exhibiting symptoms that were very suspicious it's COVID, and we're pending a test result. So we've done everything, including testing, we're just pending a result. So that's another person that you would wear this level of PPE on. So for confirmed non-COVID patients, you wouldn't wear what we're talking about today. I'm not going to get deep into that, but I'll be glad to answer some questions later. All right, so I'm going to demonstrate the process now. But actually, I'm going to pause here and I do see about donning for feet protection. So according to the CDC, and what we understand about this virus, we don't recommend or do any additional foot covering for these patients. Now, so again, my background is ER, and I've been doing this a while. I just for general, just infection prevention practices, I keep a separate pair of shoes. So these shoes here, when I come in the hospital, they don't enter my house. So I have a pair of shoes, my slip-on Birkenstocks, that I have in my car in a bag. So when I come out to the car, I change these go in a bag, a separate bag, and they stay in the car. So some people, my wife works in the COVID unit. She has a pair of shoes that she changes out of right before she comes into the house. So but we don't have anything, there's no specific guidance saying that you should cover your feet for this. If you choose to do that, that's an additional step. But what I would say is that any additional step you add to the donning process, it adds complexity and increased risk of cross-contamination during the doffing process. So that's why we try to limit it to what we know will protect you. All right, so I'm going to demonstrate now. So the first thing I'm going to say is, you notice I have my surgical mask or just my time mask. You'll probably, when you first get to work, you'll have your cloth mask or something similar to this. And my understanding, and Malcolm, correct me if I'm wrong, when you get to work, the first thing you do, I guess you'll go to your department offices versus going straight to the floor that you'll be working on that day. So first thing I'm going to assume, we're going to make an assumption, I am going to the your department offices, and there I'm going to have my N95 mask. So if I know I'm going to a COVID positive unit, I'm going to go ahead and change that out. So first things first is I'm going to change to my N95 mask. And I would recommend doing this before you get to the unit, so in your department. So for the N95, you just want to cover it with the straps hanging down. Bottom strap first, make it the neck. Top strap kind of at the crown of the head. Now, this strap will inevitably make its way down, and that's fine, but you want to at least try to get it to start up here. Because once it makes it down here, it puts pressure on your ears, and it starts to hurt after a while. All right, once I get my mask on, very important step. You want to seal it around the nose and do what we call a fit check. So fit test is what you do when you go to employee health and they spray that sweet spray. That's a fit check, just to figure out what mask you need and what size. Fit check is what I'm doing before I go into care for patients. So I'm just got to take deep breaths and blowing out, and I'm looking for any leaks. I shouldn't have big leaks around there. If I do, I'm going to readjust my mask, reseal. At that point, if I can't get a seal, I may try and get another mask. All right. If I never get a seal, then I may have to reconsider me going into that unit. All right. And we do the same thing with our staff. So if our clinical staff cannot get a good seal, we have to, it's not that you go home for the day, but we may just have to rethink your assignment for the day, your duties. All right, so assuming everything works fine, no leak. All right, so, sorry, there's a gnat on my eyebrow, of course, on my eyelash. All right, so now I'm going to the unit. The other thing I would do before I go to the unit is remove anything I think can snag or catch on the PPE. So for our team, we get them to take their watches off. If you wear earrings, because those can snag can get caught on the straps of the mask sometimes. Try not to wear earrings. Rings, the flat rings are okay, like the bands, but anything raised, that's definitely something that can snag on the gloves, either when you're putting them on or taking them off and cause a breach. So go ahead and take everything that you don't think you need off that might snag. The other thing is, if you have long hair, like Vic, just kidding. If you have long hair, you want to make sure that it's in a ponytail or a bun, so it's not hanging down. All right, so I've done all that before I've gone to the unit. All right, so I get to the unit, they should have the PPE you need to put on. You don't need to bring your own other than your N95. All right, so you get there, first thing I'm gonna do is check again myself, make sure I don't have anything else. I usually try and take my badge off, I'll either put it in my pocket. If I have something, again, the goal is not to have it protruding where it's gonna snag on something. First step, hand sanitation. Over all these years, all this fancy gowns and masks and everything, still the number one step of identified step for preventing transmission is washing hands. So 20 seconds. Then I'm gonna put my gown on. As I mentioned, it'll be a gown, but it may be some variation of yellow, blue, disposable, non-disposable, plastic versus cloth, but it will be a gown. So you just want to secure it. This one ties, some Velcro, some pull you straight over. Now, you would tie this in just a regular bow. I'm not gonna tie this all the way because I'm trying to preserve PPE and I don't wanna have to break this one at the end. Tie your waist. Again, you want to tie a kind of a snug bow, but not too tight. And I'm going to leave this again because I want to preserve this for future training. All right. All right, so gown, already have my mask. So that, if I did, this would be the next step, would be mask. But gown, I'll recheck my mask. Face shield. Now, I will mention, and those of you who already work in areas where these are required, the goal is everything is disposable, and we're trying not to reuse PPE anymore, except for the face shields. We're still trying to preserve these as long as we can. So you'll have your face shield, and you'll reuse it as long as it's serviceable. So you want to get your face shield, and the way I found to keep it serviceable longer is to put the foam piece to your forehead first, and then pull the strap over the back. I know that sounds very specific, but I've seen people put the strap first and then pull it over to the top. And usually what happens is when they're pulling it back over, it snags this foam piece, and this is just glued on here. So I've noticed that a lot of times when they're pulling it over, they'll dislodge that foam piece, and now that the shield is inserviceable. So the best way we found to keep it useful longer is put foam piece to the forehead and then pull the strap over. And then just kind of readjust. And then the last thing I'm going to do is my gloves. And the goal is to keep the cuff of the gloves, of the gown, tucked into the gloves. That way, when you're when you're moving around, you don't get any exposed skin. So the way I found the easiest way is just to pull it down a little bit. And some people will actually, with these kind of disposable ones, they'll kind of push their thumb through to kind of anchor. I don't do that. I found it works just if I just pull it down about halfway.
Andres, this is Vic. I can't hear you well. I know it's hard with a mask, but if it's any way possible, can you try to just maybe articulate a little better?
Absolutely. Is this better?
Yes.
Okay. And thank you for speaking up. If anybody else has trouble hearing you, let me know.
Okay, thanks.
And to be honest with you, that is a challenge that the healthcare workers face. It is hard to hear through a mask, through a face shield, and then through a door, because typically you limit who all's in the room. So there's a lot of communication from inside the room, outside the room. All right, I have you can see where my gown is tucked well into my gloves. All right, so this is the PPE you would use to go into a room. Before I go in, I do kind of one last check. And best practice is actually to have somebody else, another person, check you before you go in the room. So you may ask the nurse or somebody else who's around, say, hey, can you check me real quick to make sure I've got everything on right? All right, so now you're ready. So I'm going to talk a little bit about what you would do to protect yourself in your patient encounter. All right, so you're going to step into the room. I mentioned source control and limiting what we put into the environment. So one of the things that we know is that if the patient is able to wear a mask, you want to ask them to place their mask on. All right. Again, the goal is for me to not put a lot of stuff into the air and them to not put a lot of stuff in the air. That gives us the greatest chance of not exposing each other. So that's one important step for you guys to remember. So if they can tolerate it, ask them to wear a mask. Number two, try and maintain your physical distancing. So remember, unless there's a reason for you to lay hands on the patient, you want to keep your 6 feet from them. That, along with them wearing a mask and you wearing a mask, should keep you relatively safe. The other thing is, if you want, the general concept is that the highest risk of contamination for PPE is always going to be the front. Your back is what we would consider clean. So the goal is to keep the back clean and limit any exposure to the front. So how do I do that? If I do that by trying not to turn my back to the patient when I'm close. If I need to turn for whatever reason, usually it's when I'm leaving or maybe I'm grabbing something for the patient to bring to them, I'll step away and then turn as I'm stepping away. So that's 2 things. So masking the patient, staying 6 feet away, that's 2. Number 3, I want you guys to channel the person in your life that used to tell you growing up, don't touch that, keep your hands to yourself. So if you don't need to touch it, don't touch it. So leaning on surfaces, maybe on a bed rail or leaning over the bed rail. Again, if you're leaning on a bed rail, you've broken rule number 2 of your stay 6 feet away from the patient. But if you don't need to touch it, don't touch it. A lot of our exposures are secondary from touching surfaces that are contaminated and then coming and touching that zone of infection that I talked about earlier. So that's the 3 really big things that if you follow those things and have the right PPE, you're going to be fine. I promise. All right. So now let's, I'm going to pause right there real quick. So I do see a question. Can I use eye protection other than the shield or goggles? I would say I would check with infection prevention, but historically the answer is no. So glasses, do not, your personal glasses, and I wear glasses, do not provide enough protection. So there's a lot of space around these personal glasses. And face shields are preferred over goggles. But if goggles is all you have, then goggles is what you have. But I will say, I'm not recommending using anything other than those 2 things. So face shield, goggles, if you can't use either one of those, then you probably don't need to be in that area.
No, my question specifically was, if instead of the face shield, could I get a specific pair of goggles that would cover, because it's very difficult for me to see patients in the shield because the glare is just terrible.
Yeah, the one that offers most protection is the shield, and then goggles, still offer better protection, but less than the face shield.
Andres, I've actually been using these goggles that I got off one of my nursing carts, and my nurses suggested these. So I've been using these in addition to my own glasses and the face shield. And yes, it becomes a foggy nightmare, but you got to do what you got to do, right?
Yeah, so that's the other thing with goggles, and we found this out during Ebola. The CDC actually stopped recommending goggles and went back to face shields for Ebola because as a provider, me trying to provide care, goggles fogged up. And then I couldn't see, on top of being in a highly infectious room, I can't see what I'm doing to care for this patient. But yes, goggles are acceptable, and the ones that you showed are medical grade. They provide some more coverage than regular glasses. All right, great questions. All right, so I'm going to now transition to, I'm done with my patient encounter. I'm going to take stuff, I'm ready to take stuff off. So first thing is I want to be as far from the patient as possible. So typically, you're going to do this by the door. All right, I'm done with the patient. First thing I do is, just like putting on, first step is always washing my hands. I'm going to wash 20 seconds. And again, the goal is to reduce the amount of contamination or suspected contamination I bring out of the room. Every step is meant to reduce that risk. All right, so 20 seconds.
Just to be clear, You're still in the room at this point?
Yes.
Okay.
Still in the room, but away from at least 6 feet away from the patient. So preferably by the door. So the next step is I'm going to take off my gown and glove together at the same time. The goal is not to touch my scrubs or my skin. So what we found that works best is you take this waist strap that's tight, you want to break it. So you don't want to start fluffing out and trying to break it, just slow, steady pressure until it snaps. And the reason we ask you to do that is because what we found is if you just try and take it off without breaking that waist strap first, it inevitably tears apart and you end up like a skirt. And then you have to take off this second piece. All right, so I've broken the bottom, and then I'm just going to grab a handful, cross my arms and grab a handful of gown. Again, making sure I don't touch skin or scrubs. So I'm just going to kind of, I want to do this near or over the garbage can. And so I've got my scrubs, I've got my gown. I'm just going to start kind of pulling away until that neck snaps, and I'll lean forward a little bit, and I'm just rolling it up. And I'm making sure that this isn't swishing against me. That's why I'm kind of, my arms are extended, and I'm just tilted just a little bit. All right, you should end up with kind of your hand kind of at the end of the sleeve, or something similar to this. So you want to think inside is clean because it's been close to me, not exposed to the patient. So the inside is clean, outside is dirty. So I'm just going to take and kind of just hook my thumb and take this out. This again is considered clean, and I'm just going to pull it up and drop it in here. Okay. I'm going to reuse this, so I'm not going to drop it in there. Like you would just drop that in there. Next step, wash hands. 20 seconds. So you'll notice in Doffing, which is the highest risk procedure, there will be hand washing between every single step. Again, that's redundancy built in on purpose. It's purposefully redundant. All right, now I'm going to clean my shield, or in some cases, your goggles that you have. So we'll put on a new pair of gloves. We'll get a purple wipe. And I'm going to clean the outside. Again, outside dirty, inside clean. So I never want to reach up underneath and touch. I want to keep this as clean as possible so it don't touch underneath. So you're just wiping the outside. And if you're wiping your goggles, just be careful that you're not wiping into your hair or under your skin. Just be really careful about just maintaining the goggles. All right, so you'll dispose of that and then take off these gloves. Hand hygiene. 20 seconds. All right, so all of this was in the room. Now I'm ready to leave the room. So I'll exit the room. Hand hygiene. Again, because I just touched the doorknob or handle or something that more likely is contaminated. So hand hygiene again. Now, at this point, if I'm going to see other patients, this is as far as I take off. I go see my next patient, go to the next room, put on a new gown, new gloves, have my next patient encounter, wash my hands, take off my gown and glove, wash my hands, new gloves, clean my face shield, gloves off, hand wash, come out of the room, hand wash, and see as many patients as I need to while I'm there. Once I'm done, and I've seen all the patients I'm going to see, and I'm ready to go home, I'll now go back to the department. So the next steps I'm going to show you are for when I'm done for the day and ready to go home. So go back to the department. As soon as I enter the door, wash my hands. 'Cause who knows how many doors I've touched along the way, or hands that I've inadvertently shook, or so wash your hands. The face shield, I mentioned we reuse. So hopefully you'll have, we have paper bags that have been distributed for us to save these in, and we write our names on them to keep them. So I'll just kind of reach back without touching the shield, kind of reach back, grab the strap, and I'll put that back in my bag. Wash my hands, and at this point, I'm going to change back into my regular mask because I'm done. And if this is we don't reuse these anymore. So once you take this off, it goes in the garbage. Again, I'm trying to preserve PPE, so I'll reuse that. And then you'll put on your mask again. All right, so I've just gone through the donning and doffing of PPE for a COVID positive or a suspected COVID positive patient. I've talked a little bit about the steps that you would take while in the room or interacting with the patient to keep you, to reduce your risk of contamination or exposure yourself. And then so what I'm going to pause now is kind of see if there's any questions that you have. I see one on about washing hands or sanitizer or both. So typically, while you're in the room with PPE, hand washing with soap and water is the most effective. But so typically when I'm going in between patients, I just use hand sanitizer, and then sometimes if you get that sticky feeling, I'll go and wash my hands. But when I get to my office, I'll hand sanitize before I walk in my door. And then as soon as I get in my office, if I can, and I have a sink, but not everybody has that, I wash my hands with soap and water. So use what you can. Soap and water usually is the highest, but it also takes the longest to kind of dry and do. Did I wash the gloves in the room? Yes, so the first step of doffing is always wash your hands. And in the case of in the room, I do it while I still have my gloves on. Again, I know that your hands are the highest risk of contamination of all the PPE. Gloves are the highest things. That's what you touch stuff with. So it has the highest contact with indirect surfaces. So washing hands is the first step in putting on and taking off. Great questions.
Andres, the other day I was on a floor at the MCCU trying to contact a patient, and every single room had a sign that said aerosolized on it. How does that change this procedure? Because that presumably means it's everywhere in the room, right?
Yeah, so my understanding and my expectation would be that you would not go into aerosolized rooms. So aerosolized rooms requires a higher level of PPE because, like you mentioned, the likelihood that whatever procedures or treatments that they're receiving is making it into smaller droplets that are lingering in the air for longer periods of time and for probably greater distances. For regular patients, what we were concerned about is what we call droplet precautions. So somebody sneezes or coughs or even just talking without a mask, you create droplets that are typically pretty heavy. They'll travel a certain distance and then they drop. Aerosolizing, like receiving nebulizer treatments, or there's certain procedures that make those droplets smaller so the they're lighter and they linger longer. Does that make sense?
Yeah.
So to answer your question, the way it would change, in my opinion, would be that you would not go, if you see aerosolizing or aerosolize on the door, I would not go. I would expect that you wouldn't go in those rooms. And if you ever have a question, I would check in with the clinical staff and get more understanding about what does that actually mean.
Yeah, so maybe Malcolm, we could try to follow up because the nurses were trying to tell me that I could go in, and I was like, I'm not so sure about that. So if we could departmentally figure out what that means for
Okay.
us, that'd be.
So we'll say right now that if it says on the door, aerosolizing, that's an interesting hard word for me to pronounce, but if it says that on the door at this point, we will not go in. And if the nurses say it's okay, just go ahead and say, well, I've been told by our director that we are not able to go in at this time.
And it might be important, beneficial to loop Mary Duncan or Alvernita McKinney from Infection Prevention to get a little clear understanding about maybe why the nurse felt it was okay.
Yeah, I'll check with Mary.
Sign was left up there and they really weren't, who knows, but I would ask for Infection Prevention to see what their guidance is. But until you get clear understanding from them, I would say I wouldn't go in there.
Thank you.
Great questions.
Sarah has a question that says, we've been told that that N95 mask will be provided on the unit instead of in our department, which is what we're planning to do. She's asking the question, can we get that changed, or how do we swap out masks safely on the units? Could you address that latter part? How do we swap out masks safely on the units?
Yeah, so like when I go to the ED, now I don't go in patient rooms, but it's the very few times that I've had to go into an area where I believe that there's actual patient care going on. I will grab an N95 and then go to like the break area, away from the outside of the clinical area, a break room or something to swap out my masks. So again, when I'm changing or doing anything where I'm going to changing something out or putting something on or taking it off, my first step is always I'm gonna wash my hands, then take this mask off, put this back on, and then wash my hands again. But so to answer your question, Sarah, I would go to the break room if possible and do that. So I'm assuming you're talking, for you, you're still in the ED.
And one other thing I'd like to add on that, and the reason we have, in talking with the nurse managers, the reason we decided to have the mask on the unit is that we felt like if we were in different parts of the hospital and we needed to go from COVID to non-COVID patients, which of course we probably will, then we wouldn't be able to carry all the masks we needed and wouldn't need to come back to the department every time we need to change masks. So that's why we're saying at this point, we're going to start with, it's a great question, is that we will start with getting all of our PPE from the unit except for our shield, which we will keep in a bag here in the department and take with us.
And that makes a lot of sense.
Yeah.
Will these rooms have a telephone or computer to talk with the patient? Tell me a little bit more about that question, Rodney. Because I'm assuming you'll be in the room with the patient. If you're donning all this, you're going to be in the room.
I was just piggybacking on Ethan's question regarding the A rooms. I'm wondering, would those rooms, have a communication tool to be able to communicate with the patient, since we're not going in them right now?
Oh, so when you say the A rooms, the ante rooms?
No. The rooms that Ethan mentioned.
The aerosolized.
Yeah, the aerosolized rooms.
Yeah, typically there's some form of communication that the nurses or the staff have. I don't know, sometimes it's the telemedicine things. But I'm not sure. I would check. It's probably different in each unit, how they communicate from outside the room to inside the room with the patients. But yes, there's usually some way of communicating with the patients. If it's a very quick communication, what I've seen honestly is they just crack the door, lean in and ask their question and then close the door. but I'm imagining your interaction will probably be a little longer than just cracking the door and asking
Right.
a few questions. So that's a great question, and I would say that you need to check with the unit staff on what specific strategy they use.
And
Thanks.
in my experience, Rodney, from the MCCU specifically, they said like there's no phones in the rooms, there's no telemedicine. That's why she was trying to get me to go in, because they had no other way to communicate except for in person. But
Oh,
I imagine every other, like the MICU has the telemedicine. So
We will work on that, but in the meantime, you're exactly right, Ethan. We'll just say, I'm sorry, I won't be able to.
Yeah, and I would definitely say MCCU, I know a little bit about that unit. Those are just like MICU, those are critically ill patients who are getting multiple procedures that would create aerosolization. So that, to me, that's a little different than if I was going to a COVID positive, just an acute care unit where they may be getting occasional breathing treatments. I would be more hesitant to enter that room. And you're right, they don't right now have phones in the rooms, but they have some telepresence in those rooms, and it's different, but they do have some type of telepresence. So,
Okay.
so I'm looking at the time, and I want to go through one more time, kind of unnarrated, so you can see how long it takes. It really only takes about 2 to 3 minutes to put on and a little bit longer to take off, but still not a whole lot longer. And then I'll open it back up to any additional questions you guys have. And you guys have had some really great questions, so keep thinking of them. All right, so again, first step is to take off anything that I think I will need. Hand sanitize 20 seconds. All right, then I'm gonna put on my gown. Again, you would have a fresh gown. You wouldn't be reusing one that you just pulled out of the garbage. Now, while I'm doing this, I will say, some of you, I think, commented about the video and the difference in the video and what I'm doing today. The only difference really is the mask. So that video replaced my surgical mask with a N95, and it's the exact same process. I broke it. No, there we go. My face shield I've had since March, so it's been working to do my phone to the forehead first. All right, so again, I would have changed my N95 before coming out to the patient area, but since I haven't today, I'm going to demonstrate how to do that again. All right, so hanging strap, bottom one first, top one, top of the forehead, reseal, big check. All right, so I've got my gown, mask, shield, gloves, final check. Hopefully somebody's there to check me. If not, I'll just do kind of a self-check. Especially when I check your gloves, a lot of times putting on the gloves, you can inadvertently tear them. So you want to make sure before you go in. All right, so now I'm good. All right, patient interaction. Can you have your mask on? Now the patients in the ICUs, if they're intubated, they're on what we call a closed circuit. So that means everything, the droplets and everything is in that one closed circuit. So there's really nothing getting out in the air. So that's just something to consider. But again, I think we're going to err on the side of caution first until we get more clarity from the patient prevention. All right, so I'm going to ask them if I'm not in just acute care, can you put your mask on? Regardless of if they can or not. I'm going to maintain my physical distance of greater than 6 feet or greater. If I need to get closer, I'll try and limit the time in that zone so as much as possible. And then again, trying to keep, don't touch things inadvertently if you don't need to. Channel that inner voice, don't touch that. And then when I'm done, I want to make sure that I'm stepping away before I turn my back. All right, now I'm ready to doff. I'm going to go ahead and wash my hands. 20 seconds. All right, gown and gloves together. I'm going to just pop. Again, you don't want to fluff and pull. Just slow, steady pressure, brace that, and then broke it. So then you want to do this again 6 feet away and by the garbage can. Just kind of bend over, grab it down, no scrubs, and gentle, steady pressure. Boom, broke. Extending my arms, rolling it up. Just going to pull this off with my thumb. And sanitize. New set of gloves. Couple wide. Again, just clean the outside. And if you have goggles, just make sure that you're not getting your skin in your hair. You're going to take these gloves off. Hand sanitize. Open the door, come out. Hand sanitize again. You'll see my next patient, new gown, new gloves, patient interaction, same donning and doffing, same doffing process. All right, I'm ready to leave the unit. I'm done, or maybe I'm done with this unit and I'm going to go to another non-COVID unit, but I'm done with this interaction. I'm going to take this off. So if you're doing this on the unit, then you'll just find a place kind of away from the patient. Go ahead and reach to the back and just pull it over. Put it in your bag. Wash your hands. And then you'll change your mask out. Put on your new mask and wash your hands.
What?
All right. Are there other, thank you so much, Andres. Are there specific questions or things you might have missed that you want to ask about, or things that you anticipate that maybe we hadn't mentioned, or just something that you have on your mind?
I have a question.
Go ahead, Michael Horowitz, and then we'll get to the next one.
I'm sorry. Andreas is keeping the items on, going room to room for patients that are COVID, I am assuming. But if we're doing a mix, the way we would do that, taking off, taking on, what we're having on would be a little bit different in terms of logistics, especially going to different units. So will we be talking about how that will look as well among our staff? I mean, with our department.
Yeah, I imagine what would happen is that you would, if I'm going to be seeing a mix of patients, I would want to bundle them. So I want to bundle, try to see all my COVID positive patients or all my COVID non-positive patients at once before I move to the next group of patients.
Right.
So that's how I would imagine that would work. But yeah, I mean,
Okay.
Another question someone had.
Yes, it's me.
Okay.
Andreas, I have a question. So let's just say you're in a COVID patient room and you're doing, you're kind of careless. And the fact that you have all the gear on, but you take your gown off improperly, or it tears, or you forget and you scratch your neck, and then you realize what you've done. Can you still go into other patients' room that day?
so you're saying you've done something that you're afraid that you've touched a piece of your skin or contaminated? Yeah. What we do is, one, if you know it, that's great.
Okay.
Then you can address it. If I like touched my neck, you're not really putting the patient at risk. You've got stuff on you that you may take home.
Okay.
Before I go home, really, it's not the risk to the patient. So I would take what I've done before is, because I've done it, I've torn my glove and touched myself. Just wash my hands, put on some gloves. I've taken like a paper towel with some hand sanitizer and clean my neck. Take that off, take those gloves off, wash my hands, I'm done. The problem usually is when we don't realize we did something, and then we go off and do all the things, the great things that we do, and we take all the stuff with us to all the other places. So if you know something, you've done something, it's great, because then you can come up with a plan, and it's just as simple as hand sanitizing or washing that area and then washing your hands again.
Joyce Wesley had a question in the chat box, and it was a good observation. She was just noticing that shouldn't we immediately discard the cloth that we wiped our face shield with? And she noticed that you had put it on the table, but I'm assuming you did that only for this demonstration purpose because you didn't want to waste it. I'm
trying to be mindful of resources. But yes, you're correct. All the stuff like the gown, I would never reuse a gown that I just came in contact with. So yes, I would throw it and wash my hands.
Good.
You guys are very observant. I appreciate that.
Yeah, thank you. We have time for another question if someone has it, and then we'll decide what we need to do next.
I have a question.
Okay.
So we don't wear scrubs, we wear street clothes, and I just feel like maybe there are some fabrics that are maybe safer to be wearing. Can you give us, I mean, I'm not asking for fashion tips, more just like what fabrics should be.
My wife would be very worried about you if you were asking for fashion tips.
I just mostly want to know like what fabrics are safer to be wearing when visiting or when in the hospital, especially if we'll be seeing COVID patients.
Yeah, I don't know if there's specific fabrics, but I know for like providers, we try and ask them don't wear coats, like their lab coats. If you're gonna wear like pants and a blouse or things like that, just same practices for, no open-toed shoes, sandals or closed-toed shoes. But no, nothing other than, trying to limit like jackets and stuff that, just limit it to like one layer of like a blouse or a shirt or something like that.
Things that are more washable would probably make sense. Is that right?
Yeah. So, this, again, my wife works she's a pulmonary critical care NP, so she works at MI and MCCU. So she brings a change of clothes that she changes out of before she gets in the car. And then they go straight to the laundry room as soon as we get there. And we've been pretty successful so far. So great questions. And there's a lot of anxiety, I'm sure. So I want to acknowledge that. But I do want you to hear that, one, UAB has done some great things to keep you guys safe. It's been evidenced by the fact that we haven't had, I mean, I'm almost, can say this with almost 100% positivity, that we have not had any patient to employee exposures. It's all been employees that are sick, or all been from getting it in the community. That's the majority of it. But more recently, it's been employee to employee when they're getting in break rooms and taking their masks off to eat for extended period of time, and they're closer together. There's other things, but so just trust that the things that we're doing are here to keep you safe, and they're not just made up. They're very been thought through, very intentionally.
Sarah had a good question on the chat box. How often should we clean the shield when wearing it to visit non-COVID or COVID negative patients?
I guess that would just be your comfort level. I mean, there's no specific recommendations that if you're visiting non-COVID patients that because really you would just be wearing a mask. More like if it's non-COVID, you'd be wearing just a surgical mask or a surgical mask, not a cloth mask, surgical mask.
Right.
And plus or minus, I think they're adding the face shield as a
right
another requirement. So mask, face shield, and again, hopefully you do the same things interacting with them of, hey, can you put on a mask? Even though you're negative, you may ask them to put on a mask if that'll help. But there's no recommendation of how often you can clean it. If you want to clean it in between every patient encounter, I don't think anybody's ever going to say, no, don't do that.
Important thing, it seems like there too, would be to wear gloves. Always to remember to wear gloves when you go to clean your shield with the wipe. That's important. Well, I think you mentioned that before as well. That's a good question. Thank you.
I see a good question from Thomas George. Really good question. And I don't know what your policies are, but I know from a simulation perspective, we've transitioned from anything paper to electronic. So all our forms that we review with patients or with our learners are all electronic, again, to keep from handing paper stuff on and off to people.
So it's best if we really not take paper in there.
Forced us to use the technology that we've had for years and just have never used, because it's so much easier just to print that piece of paper and put it in my pocket and make my notes.
Yeah, thank you. Any other quick questions? We will stay online just for a moment, but I wanted to to honor Andres your time. Anyone else have a quick question?
Well, thank you guys.
Andres,
opportunity.
Great job. Thank you so much for your time, and especially for giving it to our team, and it means a lot. And we will, I've taken notes, as many of you have, and we'll put some of our notes together to make sure we can remember what we have heard and where we can reference it again. So thank you very much, Andres. The rest of us will stay on, and Andres, you're welcome to log off if you'd like.
Thank you.
Thank you.
All right, thank you. All right, I know there are a lot of questions we have. We won't be able to answer them all. Obviously, we'll get to everybody's questions, though, to help everyone feel safe. It's perfectly normal for all of us in doing something new, or those of us who will be doing something new and seeing COVID patients. I've received a few persons who said that they would like to be on the red team. That's great. Just let me know by the end of the week if you're able, or maybe at least by Monday. If you want to be on the red team and not see COVID positive patients for whatever reason at this point, we'll honor that. And we're going to try to do the best we can with what we have and work it out as we go. We don't have all the answers to what will we do for evening and night shifts in terms of having enough chaplains, or a chaplain who can see COVID patients, and those who cannot or have chosen not to. So we're not going to worry about all those details, but I want to encourage you to make sure that you let me know. I'm going to assume green team, but I've had several emails from a few people who said, I'd like to be on the red team, and that's perfectly fine. No problem, no judgment. And so you just let me know, and we'll start there. And along the way, if something comes up, you feel differently, then just let me or Vic know, depending on your supervisor, and we'll be glad to honor that as best we can. And we want to figure this out as we go, making sure from the beginning, anyone making visits in person to COVID positive patients feel and understand or know that you understand what you do. I can tell you from some experience, just in the last month, I have been going to the COVID respiratory outpatient clinic on Tuesday afternoons for about 3 hours and seeing patients who are coming in who are COVID positive. And at first, I was really nervous about the process and the order in which I put on, which I've learned is not as important as when I'm taking off PPE. And what I just did is I just went to one of the nurses there. And I said, can you help direct me in every step so that I make sure I'm doing this right? And then after several times, I just was like, okay, I've got it now. And I still ask someone to watch to make sure. Sometimes we don't have anybody to watch, so we're our own person and just being responsible ourselves. But we want everybody to be safe, of course. And I wonder if there are general questions that you have, or any other questions you have, not specifically related to PPE, but just how we're going to work this out. I don't have all the answers to that. I think Vic and I have talked about it in some detail, but we don't have all the answers yet, but we want to make sure first and foremost everybody's safe, and then we're going to figure out. I think there was one question I remember I wrote down. It may be from, I can't remember, maybe Dania, that said, what about let's see, what was that? Dania, do you remember?
Yeah, I just didn't know, are we, when I come in like on the weekends, are we just, is our task to see only the COVID patients who have requested pastoral care, or are we going to be doing rounding on those units?
All right, we're gonna treat that the same way we do all patients in the hospital, meaning that we are going to be focused on the pager and on who we're paged in emergencies to, and consults and referrals on the multi-patient task list. You're not expected to go into the COVID unit and see every patient.
Okay.
So we're just gonna think about it as, I'm gonna pay attention to the MPTL, I'm gonna pay attention to the pager, and those are my priorities, pager, MPTL, and go from there.
Malcolm, I have a question.
Yes.
For those of us who will be on call beginning next week when we implement this, how are you going to identify who's on the red and green team? So if you're on call, you'll know whether or not you have to go to a green area or whatever.
Yes. So what I was thinking is that on Monday, by the end of the day, I will send out the list to all of us as a team and just say, this is who we have on the green team right now, and this is who we have on the red team. If that changes, we'll update it, and we'll keep dates on the updates. I've asked for a shared calendar, not a shared calendar, we have a shared calendar, a shared folder for us from HSIS, so that on all of our, when we are here at work, all of us will have access to information that we can find and pull up easily on our desktops. So we'll have shared folders with a list of those chaplains. Will know who's on the red team and who's on the green team.
HTICU, but it's on that back corner.
Are there other questions?
Do we need to be fitted again for the N95?
How long is if it's been less than a year? If it's been more than a year, yes, you do need to be
Okay.
fitted. But I would prefer everyone getting checked. We most likely when you were fitted, we did not have the universal mask. The universal mask that for the N95 that they have now, I'm told from where we get it fitted, is 90% of people will be able to wear that mask that will fit, that it will do its job. And they test that on it. So that makes it easier.
Is that the white ones that are the universal ones? I don't know, maybe.
Yes, I think that the light was on it, so I couldn't.
Yeah.
But that's the new N95
I think so.
universal. Yes.
Okay,
Yes.
blaring, but
Yeah. Yeah. Yeah, mine looks a little bit different than that. That's kind of a cone shaped, right, James?
yes, it's still a little round, but it's not as round as the green ones are.
Yeah, yeah. I know y'all really appreciated me modeling those masks for you that I sent today. Sorry, I didn't have someone else better to. These are, they have a flap on the top and a flap on the bottom so that they fit, and cover your chin and your places where it needs to be covered. So, but these will be on the units where we're visiting. Okay. Any other questions about the process or about where we go from here?
Not a question, but a comment.
Okay.
One of my nurse managers suggested that because I have naturally long hair, that I cover my hair. And she also was very concerned that we aren't wearing scrubs. And so she has told me that I can get scrubs off my unit whenever I need to before I go into a COVID unit, and I can just discard them.
Great. That's good. That's kind of taking it a step further with the being able to get what we need on the unit, which is even better. And so that's great. I don't have any problem with that. That's good.
Malcolm, what are your thoughts in regard to the scrubs issue? What are your thoughts on us wearing, wearing scrubs that we just bring from home, just regular scrubs?
That's a good question. I don't know the answer to that right away. I made a note about it. The purpose of that being, that would be what you'd be wearing while you're at work, and then you would have your own clothes to wear home instead of wearing those home. Is that right?
Yes. Yes.
Is that what you're thinking?
Yes.
Yeah. I'll have to think about that. That's a good question. I'll look into it. I appreciated Andres his suggestion of bringing a change of clothes with us to work, whether they're jeans or whatever, that we would change into before we go home. That would be one. There are lots of strategies that healthcare workers, and you might want to ask people on your units, what do they do? But what I heard him saying was some people bring extra pair of shoes to work, and they leave their work shoes that they go onto the units with here at the department or in your car or wherever. And then you could certainly do the same thing with a change of clothes. So there are a couple of ways of looking at that.
And Malcolm, just to piggyback off what my nurse manager's concerns about us not wearing scrubs, she said, I think your department needs to pick a color and y'all should start wearing scrubs. So just food for thought.
Okay, as long as it's orange and has a tiger paw on it.
Is
I was going to say tie-dye. Tie-dye.
I can go for that, Malcolm. I can go for that.
Yeah, thank you very much, Lloyd. Yeah, okay. I'll ask that question. I'll check on. Can we get can we decide on some pastoral care scrubs? That's great. I hadn't thought about that. Thank you.
We get black with white collars.
Yeah, that's good. I'm sure everybody would love that.
I think black and white vertical stripes.
Yeah, yeah, like we came from prison. Yeah, Sarah, you're saying an advantage of the scrubs would be being able to wash them in hotter water and street clothes. Yeah, y'all are good. We'll figure this out together.
What practically will the working together as a staff between the red and the green team look like? How will we cover COVID patients that are maybe in red team units? What will that look like?
So I think it's going to take my suggestion, my thoughts about that is it will take some communication between our team or within our team, so that if you are on the green team and you see patients on the list, it's a communication with admin notes or with the chaplain on that unit if they're on the red team. So we're gonna have to figure out, how do we decide who goes where? And I think the first place I would start, Vic and I talked about, is it's what our PRN chaplains do, or when we're on Fridays when we have fewer staff chaplains. We don't have residents here, and what we do is we look at the list and see where can I go, and I put an admin note on that, and then choose that. It's going to just take more thought in terms of teamwork, depending on where you can go or not, and you see who's out that day and so forth. David Johnson, you're a comedian, I see in the chat group, which is really unusual for you. To answer your question of how exactly will we do it, we'll have a starting point, and we're going to see how this works in terms of who do we have on the green team and red team come the end of Monday. I know we're starting to see COVID patients on Monday, but it will take a while for the nursing staff to be familiar enough to know, oh, okay, we can make referrals and consult, or referrals to pastoral care now, or can page for COVID patients. So it may not be dramatically different in the beginning because we'll have enough people here, especially during day shift, but and it may be, there's a lot of maybes. So I'm willing to live into it, and for us to decide together, how do we make this work? It may be that some people who are on the green team may need to choose more as we go along on who are COVID positive, and that will mean we'll ask and put this out to the team. Please see some of this chaplain. I don't want to over analyze it in the beginning, but I do want you to know we'll work on it just like we do when PRNs or others come in, who's going to go where for what reason, so that it's going to mean we need to talk about it. So that'll be good.
A little disappointed. I was hoping you were just going to tell us where to get the black market vaccine.
Yeah. Well, the good news is vaccine is coming. I hear possibilities, but I can tell you that seeing COVID positive patients in our hospital, those of us who are able and can, will allow our department to get the vaccine, just like nurses on the floors as well. So it's not that the green and red teams will be treated differently, but that we will be able to access the vaccine sooner as healthcare workers. So
do we have any sort of timeline on that? I mean, I know
No.
they're supposed to
Yeah.
have. Yeah.
now, I'm reading emails every day about the vaccine from leadership. The earliest I've heard for very specific units, obviously starting with the COVID, all units, those healthcare workers who work on those units. But I've heard before the end of this month, but that's a starting point. It's a good question, James, but we don't have exact dates because I don't think anybody knows about how much vaccine we're going to have, how quickly. So we get, that's going in the planning stages from the emails I'm getting. So I'll let you know as soon as I do, obviously. Okay.
Will
Yeah,
that be,
Katie.
sorry, will that be provided to us whether or not we are insured through UAB?
Sure. Yep. If you're an employee here.
Okay, cool.
Yep. Sure will. Any other questions right now? Well, if you feel a little bit nervous, welcome to the club. This is new, and anytime we're doing something new, we need to help one another and teach one another, share experiences and so forth. I know I've said this before, but I've in my career here, I've never seen nursing so excited about chaplains coming to see COVID patients in person. I've never seen a response the way I have. So those of us who will be able to do that, great, but we need all of us, because those who need or want to be on the red team, you'll need to also help us cover what we can't do everything. So we'll figure that out, and we'll communicate with one another and go forward. So, all right, this has been a productive staff meeting, and I'm so thankful. We've had in one part of our meeting, we had 28 of us here. That's about the most we've ever had gathered at one time. I'll keep this recording. I'll post it and let you know where you can look at anything different if you want to, or whatever, and we'll go from there. Just as a reminder, something new for us is that cloth mask will no longer be acceptable in patients' rooms. Obviously, COVID negative patients. We can wear them within the public areas of the hospital as well as in our department. But when we are on units, if it's COVID negative, then we're wearing the procedural mask. And if it's with a shield, and if it's obviously with COVID positive, we'll be within 95s with shield and other PPE. So that's a new development just in the last week. So adjusting and readjusting, that's our mantra, isn't it?
Are those masks in the department, within the department, Malcolm, or do we need to get them on the units?
You'll need to get those on the units. There are some still in the department as a starting point.
Okay.
But as we go forward, instead of us running up there all the time to get them, we'll just get them on the unit. So you'll be able to wear your cloth mask, depending on what kind of unit and so forth. So
Malcolm, taking our cloth mask off when we get to the unit, then we don't have anywhere safe to put it while we're going in the room. So taking it off and putting it in our pocket and taking it back gets cross-contamination.
Mm-hmm.
So we would really, I think, having one to at least to get one to start the day, a procedural mask in the office.
Okay. All right. Okay, well, I will also teach all of you how you can go get a box of mask if we're running low and you see that.
Sounds good.
That way we don't have to just depend on me, which is never a great idea. So if you So that's a good point. For having procedural mask in particular, we'll see if we can just keep those as much on hand as possible so that we can wear those up to the units. Okay.
Yeah. And
good.
Malcolm,
Yeah, Ben.
on that note, sometimes on the evening shifts or the weekends, at least over the last probably month, but at different points, it's been harder for the PRN staff who's coming in at regular hours to be able to do that. I don't know if there's a place where, other than the units themselves, where we could get that, but that's just something we can be mindful of too, as we're getting masks to keep stocked in the office. That would be helpful.
Okay. I'm gonna put you in charge of that. Thanks, Ben. Good. All right. Well, thank you all so much for your time today. We've gone much longer than we normally do, gone to an hour and a half, but I think it's been helpful and worth it. And we will continue. My hope in getting a shared folder for us on our computers is so that whatever information is updated, you can just go there. It will be dated, and this is the latest information, so that we don't have to, I mean, we can still email, but we all get plenty of emails, and it'd be a way to make sure we're staying safe. So as soon as we get that available, I'll let you know. So, all right. Thank you all very much. Blessings on your day. And I hope you can be safe and stay with us. God bless you. Thank you for who you are. Bye-bye.